So I had the privilege to be involved in the EMA meeting, the European Myeloma Academy, and the main focus of these meetings is to provide up-to-date information which is relevant for managing patients with multiple myeloma and associated diseases such as Boehm syndrome, amyloidosis, and so on, and to provide newest scientific information, but also new practical or management data which are helpful, which help us to improve the outcome of our patients. And so for the next EMA meeting, which will be held in Madrid in September this year, we expect more data on Daratumumab combinations, on other antibody drug combinations. These, of course, antibodies have revolutionized and will still further revolutionize the way how we treat patients with this disease, because they will be incorporated in the presently available regimens. So we will have conventional novel drugs plus a monoclonal antibody at the onset of treatment. At this point of time, these antibodies are only approved for relapse-refractory disease, but there are many studies ongoing in first line, using them in first-line treatments, and I think the prospects are very good that they will show a significant improvement. So we'll have a lymphoma-like therapy also in myeloma quite soon, and this will help us tremendously to improve the outcome and to increase the cure rates. I don't say myeloma is incurable in these days, because when we look at the outcome of our patients which we have transplanted in our institution in Vienna, we see that 20% survive after 15 years. And when we consider that those patients have been transplanted since 1994, and in most of them all drugs have been used, there is a hope that there is a small minority which you can't cure, or where you can achieve, let's say it with more cautiously, long-term remission. With the novel drugs, these numbers will increase certainly, and I think this success story is continuing. When we look at the research arena, we see many new drugs coming up. But I don't say it will be an easy go. It will still be hard, particularly to manage the outcome of patients with so-called high-risk features, with very old patients, So it's not an easy go. So we need to join forces from all centers in the world and to invest energy, capacity, in order to make future steps, future improvements step by step. So it won't be like it was Richard Nixon's vision, that we just can invest more let's say a couple of billion of dollars in research. Cancer research is something which takes place stepwise, and you cannot, let's say, foresee which innovation will be made next year or in 2 years from now. So we are a little bit dependent on serendipity, what happens. But what we need is, of course, talented people working in this field and trying to give their best and to invest all their time to make things better in the future.